Hi, I'm Tanya Lehmann, the Chair of the Board of the National Rural Health Alliance. We're here in Hobart today, which at the tail end of the 15th National Rural Health Conference. This conference occurs every 2 years. It brings together health professionals, community representatives, consumer advocates, researchers, experts from right across Australia and some from overseas to talk about rural health and what we need to do differently to address the completely unacceptable inequities in the health outcomes of our rural and remote Australians compared to the rest of Australia.
And we've had a very powerful keynote presentation from Cassandra Goldie this morning from ACOSS. Cassandra, can you tell us a little bit about what you were talking about and why it actually matters for health?
Well, of course, the National Rural Health Alliance, Tanya, is a really key partner with ACOSS. And the strong focus that you bring on regional communities and the regional voice. And can I assure people in regional communities the politicians are listening? Just a very interesting New South Wales election, and what was one of the major messages out of that was that the regional communities can see that, you know, the politics is not delivering the kinds of policies that are going to work on the ground in regional Australia. And so this is a really great moment for regional Australia to lift up your voice and say what you need in your local communities. And so today we were really pleased. ACOSS, as the national body focused on tackling poverty and inequality in Australia, knows that that is a big issue in regional Australia, and certainly the inequities are much greater in regional Australia than they are in the capital cities. And of course, there's a great leveler for all of us. When your health goes, you really feel human.
Yes, and you presented your election health policy.
That's right.
Can you give us the key elements?
Yeah, and so the reason that we wanted today to say we can absolutely do the right thing in terms of health outcomes, including in regional communities. We're the wealthiest country in the world. We're spending billions on policies that aren't working, and we should be saving on those billions and putting them into the things that we really need. So firstly, we do want to finally introduce a tax that's right on sugary drinks, and also a proper level of taxation on cheap wine and cider, and use those billions saved from the raise from those measures to put straight into health promotion in the communities, community-based health services, including in mental health, tackling obesity and some of the other challenges in the community, in the hands of the community. That $3 billion is what we want. The second thing is we must finally build dental health care so that it's affordable and you can get to a dentist that's close to home. Okay, so we know that that's what's stopping people from looking after their teeth, and if your teeth are bad, it makes you sick. It makes you sick, you end up in hospital. Often it means it's tough to get a job, it's tough to get a rental. It's a really crucial and enormous gap in our healthcare system, in the wealthiest country in the world. Let's get rid of that private health insurance rebate. I don't know, many people in regional communities are kind of going, what should we do? Why am I spending more out-of-pocket costs going to the doctor when I then need some follow-up care? Oh, hang on, the bills get bigger and bigger for me, but I'm paying insurance. What's going on here? Well, we want to assure you it's a failed policy. We're spending $6 billion on that rebate. We'd abolish it tomorrow, and we'd put that $6 billion into the public health system and make sure that that's getting again into the hand of local communities, local health professionals, community experts. And we could really get some amazing health outcomes if we got that right.
Now, Tanya, you're nodding your head a lot there. Does the Alliance have a formal position? Do you support this health policy platform?
So the Alliance has 41 member bodies, so we're as diverse as the Country Women's Association, the Royal Flying Doctors, the doctor groups, allied health professional groups, so clinicians, researchers, educators. It's a very diverse church. The Alliance absolutely supports the notion of improving access to services and getting the services where they're needed. Absolutely supports the need to tackle social determinants of health and poverty, and all of the things that go with poverty and the lack of access to employment and education and dental health, and all these things are of significant concern to the Alliance. So absolutely the Alliance is behind the concepts of let's stop wasting money on things that are not working, and let's reinvest in the future of our rural and remote Australians, which is the heart of our country, and it's an important investment for us to make in terms of the health of the future, and it goes broader than some of these great policies that ACOSS are advocating for. So certainly our conference and the 1,100 delegates here are all saying it's not good enough that that the richest country in the world still has third world healthcare, third world health issues that's within our financial reach to address. What's going on? Why are we not doing that? It's not good enough.
So I saw that ACOSS put out a statement this morning that Townsville Council has supported raise
Hello, Townsville.
raise the rate, which is very
Yes.
significant, as we know, a
Yes.
marginal seat. So does the Alliance have a formal position on the Raise the Rate campaign? Have you signed it? Are you planning to? Will you
That's a
take
really
it to
good
your
question.
members?
Well, certainly we'll take
we
it to
should work
council.
that out
Let's
today.
work that out. Absolutely.
Okay.
So because of the diverse church
That's right.
of the Alliance, we want to make sure that all of our members agree with something before, as an alliance, we support it. So I know a number of our individual member bodies already have.
That's right, absolutely.
And it's certainly, the principles of it are exactly what both the Alliance has been going on about for years and what conference is calling for in this conference here in Hobart.
So it is important just to let people know that we are absolutely pushing the campaign to raise the rate. It's raisetherate.org.au. That's the campaign website. Get on board, get to support. This is about getting a $75 increase per week to the unemployment payment New Start, which last week, to our great shame, celebrated 25 years since it was last increased in real terms. And look, this is in the face of a government that says, oh gee, that's really expensive to do that. Well, yeah, it would cost $3 billion a year. But think of the benefits, the social benefits, the economic benefits, particularly in regional communities, and that's why the Townsville City Council is the latest of the regional councils to get on board, because you see it at the local level about what it means for people to just be going without food. And of course that affects the local economy. People are not spending because they don't have the money to spend. But the Commonwealth Government's making choices here. They've spent $144 billion in personal income tax cuts over the 6 years that they're going to be introduced. So I think in the federal budget next week, if you want to have a say, speak up. So what do you want? Do you want more tax cuts, often going to the higher end, in terms of wages? Or do we want to make sure that we're getting the money into our great public health system, into community-based healthcare services, into the regional areas, and making sure that we're finally tackling poverty and disadvantage?
And you did put out a call for delegates to consider signing a joint letter saying no tax cuts.
Yeah, look, we're really keen to provide a way for you, the community, to have a voice. We need the community voices in the Australian Parliament. There's going to be a pressure cooker next week as this federal budget is released. There's a lot of speculation that the coalition government will try and put more tax cuts through the Parliament before they go to an election. Well, I think we need to let the senators in that Parliament know what the community wants, what the choices, what the priorities of the community are. I would have thought getting a first-class, excellent healthcare system right across Australia, including for our teeth, dental care, which is not part of our health system properly at all, has got to be a high priority.
Thank you very much. Tanya, can I just check regarding the Raise the Rate campaign, putting on my journalist hat, would it be fair for Croggy to report that the Alliance will investigate whether it signs?
Yeah, absolutely. So I'll take that to our council and our members. Like I said, it's not something that clashes with any of our standing existing position statements, but I need to, in true alliance fashion,
Yes.
It is about the voice of the collective, and so like in any co-designed and collaborative model, the theme of our conference here is better together, and you stay better together and stronger together when you communicate effectively and you make sure that everyone's on song. So absolutely I will take it to our council for consideration.
Fantastic.
And that kind of discussion that it will stimulate is really important, because if you're one of the lucky ones where unemployment hasn't happened to you, you could be forgiven for thinking, our social security system, if you listen to some of our politicians, it's really generous, you're sitting on a couch, all the rest of it. If it's happened to you, you really know how brutal it's become. And so this hopefully also, Tanya, will be an opportunity for amongst the members of the Alliance to talk and get a better understanding of where we've got to with our income support system. And I'm pretty confident you'll get on board in the end of that discussion.
And just before we wrap up, any final words from either of you? Anything that you haven't covered that you would like to?
I think the critical thing that the Alliance has been advocating for some time is improving access to health services, but we know that's only 20% of the explanation for the health divide between country and city. That a whole range of other things that go to poverty, employment, clean and safe housing, these basic human rights are what's standing between a huge number of the 7 million people living in rural and remote Australia and the health and wellbeing that they all deserve.
Yeah.
Thank you. Anything you'd like to
Well, look, I obviously you can see that Tanya and I are very much of the same view, because we have some of the best health experts in Australia. The health experts are all on the same page with this about this, tackling poverty and inequality as a main game when it comes to getting better health outcomes. And we've released today a platform to make it very clear that this is tackling of poverty in Australia is entirely a question about choices that we're making, and that in the end is going to be choices partly in Canberra, and then the mobilising of local communities to get behind the kind of changes that you want to see if you're given the resources to do it. And that's what we see everywhere we go, isn't it? There's great community leaders who are clear business leaders locally, who can see what they could do, but they need governments to get behind you. So we hope that's what the politicians will hear.
Well, thank you both very much for sharing this conversation with us at the National Rural Health